Hello, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with chronic renal failure. Last class, we had discussed regarding acute renal failure. Chronic renal failure is also called as ESRD. ESRD, that is end stage renal disease. We'll see what is chronic renal failure. What is ESRD? We'll see. Here, it is progressive irreversible deterioration in the kidney's ability to maintain metabolic fluid and electrolyte balance results in uremia. Here, deterioration is nothing but a degeneration. Degeneration, that is in the kidney's ability to maintain metabolic fluid and electrolyte. There will be the imbalance between the metabolic fluid and the electrolyte. Fluid and electrolyte imbalance we can see. That is results in uremia. Presence of urine in the blood. This is what we call ESRD, end stage renal disease. Next, we will see the causes for this. First of all, diabetes mellitus can be the cause. Hypertension, high BP will be, and then pyelonephritis. Here, that is inflammation of kidney due to the presence of bacteria. That is pyelonephritis. UTIs, urinary tract infections or obstructions by calculi, tumor, etc. And then nephrotoxic agents. Nephrotoxic agents like excessive diuretics, or it can be the NSAIDs can be the cause. This is all about the definition and the causes. Next, we will discuss the pathophysiology of chronic renal failure. Here, first and foremost, the trigger that damages the nephron. Due to that, damaged nephron can't filter blood. That's what happens here. Decreased GFR, glomerular filtration rate, is going to be decreased due to the damage of nephron, as well as there will be the no filter of blood. And then due to this, it leads to decreased urine concentration. That lastly it leads to ESRD progresses. ESRD is nothing but a end stage renal disease. End stage renal disease. It's going to progress. This is all about the pathophysiology of ESRD or chronic renal failure. Next, we'll see the stages of chronic renal failure. There are 3 stages. First one is reduced renal reserve. Here what happens in this stage? In the first stage, nephron lost their function. In this stage, nephron lost their function, and then comes to the second stage. Here, renal insufficiency. Here we can see polyuria and nocturia. Polyuria and also nocturia. Polyuria is nothing but there will be the increased production of urine, and then nocturia is nothing but a frequent urination at night, we can say. And then comes to the third stage, that is the third stage, ESRD, end stage renal disease occurs. End stage renal disease occurs. These are the 3 stages of chronic renal failure. Next, we will see the clinical manifestations of chronic renal failure. And then here, hypertension, pulmonary edema also we can see, fluid overload, uremia fetor or uremic fetor, that is smell of urine comes in breath. And then convulsions, memory impairment, after that nausea and vomiting, decreased urine output, and then diarrhea, also constipation also we can observe here. These are the clinical features of chronic renal failure. Next, we will discuss with management. Here, first of all, nutritional therapy can be given. Nutritional therapy. And also, here, dialysis. It's a procedure to remove the excessive kidney waste, renal waste. And then nutritional therapy, dialysis, and then pharmacological therapy can be given. Pharmacological therapy. Therapy, it is totally based on the clinical features, based on clinical manifestations. Next, we'll see this one, complications. Complications of ESRD. Hyperkalemia, bone disease, here hyperkalemia, bone disease, anemia. Here hyperkalemia is nothing but there will be the potassium level increased in the blood. Bone disease and then anemia, and also we can see the hypertension here. Hypertension. These are the complications. I hope you all are very clear with the topic chronic renal failure. That's also called ESRD. I hope you like. Please share and subscribe to my YouTube channel for more informative content. Thank you for watching.